Hello, everyone, and welcome to Connecting to Share at a Fraction of the Cost for practices that use Greenway's Prime Suite EHR system. Thank you all for joining us today. We really would like to hear from you and want to include your voice in the conversation, so please feel free to ask questions and share comments. Just use the question and answer panel on the right side of your GoToWebinar player to share at any time during the webinar. And you can also wait until the end to ask questions as well. So here's a quick look at what we'll cover in the next 30 minutes. First, I'd like to introduce our speakers and everyone on the call today. And then after introductions, we'll give a quick overview of Share and give you an update on who currently uses Share. Then we'll talk about specifics of the Greenway and Share partnership, what it is and what you'll get. And after that, we'll look at what's in it for you and give 2 compelling reasons why you need to connect your EHR system to Share. And finally, we'll close with pricing and details on how to get started. And we'll also take some time to address your questions at the end. Okay, so without any further ado, let's get into introductions. My name is Christy Williams, and I'm the moderator for today's webinar. I'm the Public Information Officer for the Arkansas Office of Health Information Technology. Ooh, that's a mouthful. We're the state agency that's responsible for establishing and implementing Share. I hear a lot of folks hopping on the line right now, and I can hear some speaker phones in the background. If you all wouldn't mind, please just put your phones on mute. Thank you very much. Okay, we've also got Kim Wagner, and she is Share's project sponsor. She has more than 20 years of healthcare executive management and health IT experience, including 15 years of leadership roles with national companies including Siemens and McKesson. Most recently, she has served as a business development and technology officer with a national HIE software vendor. She brings a wealth of senior leadership experience in large multi-health system implementations, HIT business development, contract negotiations, and process improvement and re-engineering. She's played a big role in Share's success so far, and we're very honored to have her speaking today. Mark Walker is the program manager of HIT Arkansas, which is the regional extension center for the state. She leads a team of 10 health IT specialists who provide project management services, meaningful use guidance and education, assistance with attestation processes, and preparation for interoperability. Before joining HIT Arkansas, Mark worked as a clinic administrator for 27 years in Harrison. So she's intimately familiar with the unique challenges you all face every day, and we're really glad to have her presenting today. And now I'd like to quickly introduce everybody that we have on the line today. See, on the call we've got Allison Overton. She's the CCRC at the Women's Clinic PA. Andrew Luker. Brunella Moran, I'm sorry if I'm butchering any of your names. HemTech 1 at Baptist Health Home Infusion. Cindy Poland, she's an administrative assistant at Conway OB-GYN. Debbie Tayem, EHR project manager at the Arkansas Department of Health. Gary Paxson, CIO of White River Health System. Hazel Ames in the insurance department at the Conway OB-GYN Clinic. James Penrod, he serves as executive counsel on the OHIT HIE Council. Candy Ward, she's part of the insurance department at Conway OB-GYN Clinic. Lamita McMillan, she's the office manager at the Renaissance Women's Center. Laura Thompson, practice solution analyst at AHIN. And Sarah Robinson, NHA at the Arkansas Veterans Home in Fayetteville. All right, now that we know who's on the line, let's get down to business with a quick overview of Share. So what is Share? Share is Arkansas statewide health information exchange, and it gathers your patient's clinical data from all participating healthcare providers regardless of their EHR platform. In a nutshell, Share provides an interoperable platform for different healthcare providers to share their clinical data. It's operated by the Arkansas Office of Health IT, and we are a state agency funded by a combination of public funds and user fees. As you can see in this illustration, Share pulls together your patient's health information from many different types of healthcare entities and really gives you a more complete view of your patient's health. Through Share, you can see your patient's clinical care summaries, lab results, discharge summaries, radiology reports, medication histories, transcribed documents, and more in real time through your EHR system. Of course, Share is only as valuable as the quantity and quality of patient information that you can get out of it, and I'm happy to report that we currently have health data for almost 500,000 unique patients flowing through Share today. And these are patients who've been given a chance to opt out and have said, you know, I really do want all my doctors to have access electronically to all my health information. Patients are really excited about Share. They see value in it, and they're overwhelmingly choosing to participate when given a chance. For practices, the benefits of using Share are really numerous, but they can be boiled down into these three main points. By giving you access to more complete patient health information, Share can save you time, it can save you money, and it can help you improve patient care. You'll see these benefits explained in more detail throughout the webinar. And now I'd like to turn the floor over to Kim Wagner, who will bring you up to speed with Share adoption and then talk about what we've negotiated with Greenway on your behalf. Over to you, Kim.
Thanks, Chrissy. Good afternoon, everyone. Welcome to the webinar. Just a housekeeping item, if there's anyone that we didn't have on the roll call, if you can send Chrissy a note to make sure we get you on there so we can follow up with any questions that anyone may have at the end. So, you know, Share has just been a phenomenal success in the state of Arkansas. And I think this slide really says it all. We'll go through and pick out the other slides and actually break down these 104 health sites in the detail. But our first pilot went live in December of 2012. So we're in August of 2013 now. So a little bit over, 8 months, right around 8 months time frame. We have over 104 healthcare sites, not necessarily individuals, because there's a lot more individuals in those sites, but healthcare sites across the state either participating or in some stage of implementation or getting ready to kick off implementation. So we're well on our way to really getting a lot of participation across the state and particularly in specific communities throughout the state as well. So now, Christy, we're going to look at actually who's live on us. Who makes up those 450,000 patients? Where's that data coming from today? And the amazing thing is, it's only coming from a small portion of our hospitals and practices. We currently have live North Arkansas, which was our pilot up in North Arkansas Regional Medical Center, UAMS, obviously throughout the state, but it's heavily focused in Little Rock and with satellites throughout the state. And JRNC, Jefferson Regional Medical Center in the southern end of the state. With these three hospitals, we have captured 450,000+ patients and started collecting data on them. So we're continuing to build that system throughout. Now, the practices on the right hand of the slide here are primarily e-clinical work practices. Some of these brave souls that I think we have some on here were pilots with us coming on board, but we have a tremendous amount of e-clinical work coming on board because they actually signed a statewide contract just as Greenway did. So we are actively rolling them out about, I think if anybody's on the line, correct me if I'm wrong, but anywhere from 2 to 3 every couple of weeks. Now we'll look at who's in the implementation stage. We are very excited to announce that we have Children's Hospital coming on board. They are getting ready to kick off their implementation. They're a Meditech. They'll be using Meditech for their hospital information system. White River Health System and Cornerstone that works with White River. We're very excited. Now, their Meditech HIS information system customer as well. However, they have a lot of Greenway clinics, and we're very excited to be bringing them on. Stone County, Magnolia Regional, which is a PPSI site, and so we're really starting to expand the number of vendors and the number of customers. So we're expecting with these hospitals and these practices coming on board, continuing to grow those number of patients, probably at least by a third. Now, on the practices, I'm going to point out a couple of large practices here.
Do you know what the access code is
for
our conference line? I just wrote down the house number for it.
In the pilot phase,
Yes.
July, from a pilot perspective. But those 80 sites will be coming live throughout this year and early in 2014. NEA Baptist, Our Care, and a host of other ones here that you see on this list. The systems vary. We have quite a few Greenway in this group. We have clinical work. We have Success EHR, GE, Centricity. As you can see, we're really starting to move across the vendors and with customers that have multiple vendors. Go to the next slide. Now, before I jump into Greenway, I do want to just add to those slides, which we don't have them included, but we also have, I think it's over 3,000 plus users, maybe even more now. I haven't seen last month's count, of participants and practices and facilities across the state using our secure messaging products as well. So these, again, all of the sites you see here are the ones doing our full HIE services, interoperability, or using our portal to access the longitudinal patient record on the patient. I'm going to flip you back on one more slide there. I got off page there. Christy, sorry about that. Greenway, I have to, I don't know if Little Rock Pediatric Clinic, I didn't hear that they were on the phone.
My goodness.
We've got slides going everywhere, Christy. There we go.
Okay, sorry about that.
I don't know if Little Rock Pediatric Clinic is on the phone or not, but they have volunteered to be our pilot practice for Greenway, and we're very excited about that. White River and then the Department of Health, the health department, are two of the other brave souls that have gotten in line with us on the Greenway Clinic. So we're very excited and would just like to thank this group for jumping in. And we're really looking forward to getting the rest of the crew, Greenway customers, into to get you guys started. Now, this is actually a quote from one of our eClinical Work providers, unsolicited, called in and gave us this quote. And it's very important because the interoperability that we are going to be implementing with Greenway is very similar to what we're doing with our eClinical Work practices across the state. And the important thing to take away from this quote is that the actual providers are seeing value in getting this data and using this data to be able to take care of the patients on a day in and day out basis. And the real key, and I'll point this out in the technical pieces that what we're going to be implementing with Greenway, but the providers are consuming the data within their EMR. So it's not an additional click or 3 clicks that they have to move forward with to be able to access the data, which makes them, just part of their day. It's really not intrusive to their time. We're looking forward to Greenway physicians quotes here coming up very soon. Okay, Greenway and Share. Greenway has been a great partner of ours to work with. eClinical Works was our first vendor that we brought on board. Greenway was our second vendor, statewide vendor that we brought on board. And we're very excited about the process of bringing all the Greenway practices on board to Share and putting that in place. At the next slide there we go. Before I actually get into what we're going to be doing with Greenway, I want to kind of give you an overview of what your practice would look like without Share, and then kind of show you the benefits of what it would look like with Share. So without Share, if you as a Greenway practice or any vendor or any practice across the state will have to, will be required by your vendor or by meaningful use or whatever the case may be to do direct connects with hospitals, labs, pharmacies, public health, the registry that a lot of you guys are familiar with, any payers that you're associated with if that's the case, and any independent centers, that radiology or any other ancillary centers that you need connection with. And we share the real benefit that we bring, especially with our partnership with Greenway. Let's go to the next slide. There we go. I think this picture says it all. We share, take the data, and then create those interfaces with those individual areas and interact as a one interface from your clinic through Greenway to share to all of these particular stakeholders and back. And that really is as simple as it is. In phase one, let me kind of step back here and talk about Greenway. Greenway's model is a hub model. It is a statewide model. And we are in the implementation phase right now of installing what we call the statewide hub for all practices throughout the state. And then each practice will connect and come on board as they decide to join share and come on board. So we are in the process of that implementation with estimated live date on that being fourth quarter in the next probably 12 weeks or so. And in that phase one, your practice, Greenway will be able to send data to share. When we say ADT data, that is somewhat of demographic data. This is how we actually map the patients to your practice. So that's very important. And then also transcribed documents. And what we call to define transcribed documents is really more of the clinical notes and any particular data, clinical data needed to complete the patient's record from a share perspective. The other real important piece of this whole slide is your system, the Greenway system, will also have the ability to receive lab results, radiology results, reports, and discharge summaries, agencies, etc., from either the hospitals or from share on your patients, and that will be able to be consumed in your system, the Greenway system. The other piece is to be able to coordinate with the orders for participating labs and hospitals. There's two phases to this piece. We've got a phase one and a phase two on the orders piece. The fourth bullet there is exchanging the CCD. That will be part of it as well. Although, with consuming the data and as well as sending the data, the CCD can also be sent as an add-on to that or as needed. Sending immunizations directly to public health web IT. That is the other piece that Greenway is going to be implementing first in phase one. And then we're going to move on to early in 14 to phase two. Some of the real important items here to point out, I'm going to kind of start at the bottom and work my way up, is the immunizations. Greenway currently only sends immunizations to the public health. They will be receiving immunizations back in and doing bidirectional with the public health in 14. That's on their roadmap. And then we will implement that component with them, as well as a more robust ordering, bidirectional ordering piece for the patients with share and with any other individuals that you need to place orders with. The other two areas that Greenway has on their roadmap and we're very excited about implementing in 2014 is to be able to receive alerts. When we say alerts, maybe for example, if your patient has been in the emergency room, being able to receive that notification in your EMR. So for your provider or caregiver, or depending on how your workflow works in your particular practice, you'll be able to receive that alert saying that your patient has been in the emergency room. Very important, especially for any practices to patients in a medical home or any kind of other type of model like that. And the last thing is syndromics, which is a meaningful use criteria, and Mark will be going over that in more detail, but they will be implementing, they being Greenway, will be implementing their syndromic piece in early 2014 as well. Future phases. The immunizations, actually, I jumped ahead on that one. The immunizations piece that we talked about earlier. The other piece, which not a lot of the practices are probably submitting this yet, but electronic lab reporting directly to ADH, and then the cancer registry will be the other three pieces. You guys probably know Greenway's schedule better than I do, but they are on the roadmap for 2014. Statewide pricing, as I mentioned earlier. With Greenway having, I think they have over, I know they have over 100 practices in the state, and that's probably just individual systems, and then, you know, total locations are even much greater than that. Greenway and quite a few of the other vendors have a huge population in the state of Arkansas. So Share's strategy was to go out and chat with these vendors, to partner with them, to say, how can we work with you and with our practices, first of all, to create a standard system across the state, integration with Share. And second is to be able to reduce the vendor fees, if possible. Not necessarily the Share fees, but the fees that are charged to you guys as practices. And then also streamline and standardize our implementations and our go-lives to be able to do those quickly. And Greenway has been a super partner in coming to the table with this year, and I'll be excited to tell you they have waived all the one-time fees for all of the Greenway practices that go through Share, and will only be charging support. So I'll go into more detail on those fees in just a few minutes. But at this point in time, we are very excited about Greenway being a partner. And now I would like to turn it over to you, Mark, to talk about meaningful use and what you're seeing in the marketplace.
Thank you, Kim, and good afternoon, everyone. Next slide, please, Christy. As our team of implementation specialists work with many of the practices throughout the state of Arkansas, we find that interoperability, or the ability to transmit data to other entities, and at this time it's primarily the public health agency, this is a real challenge for most practices, because most practices do not have dedicated IT staff on site or within their organization, and they're struggling to understand the process of testing their EHR's ability to transmit HL7 messages, or their vendors are having to test their capability to submit electronic data with the public health agency. And the practices are learning that the interface for submission to one entity, such as the immunization registry or the Department of Health, may not be the same interface that is needed to receive lab data from their local hospital, for example. And they're learning that there's often a high cost associated with these interfaces. So having one interface in place that will facilitate the exchange of data to or from multiple sources would lift a lot of the technical and financial burden off these practices. Now, currently in 2013, all providers are still in stage 1 of meaningful use, so they're required to select only one of two measures having to do with the electronic submission of data, either submitting data to the state immunization registry or submission of syndromic surveillance data to the public health agency. But in 2014, the requirements having to do with interoperability will increase. There will be a couple of core or required measures having to do with interoperability, and they're some of the ones that are listed here, such as providing a summary of care records to providers when they're referring patients, or the ongoing submission of data to the immunization registry are going to be required measures. And another measure that could fall into the required category could be the requirement to incorporate lab tests into the EHR structured data, because we have found that some practices order most of their lab tests from their local hospital rather than having a reference lab. So also in addition, in stage 2, 3 out of the 6 menu measures have to do with electronic submission of data to public health agencies or to specialized registries. So again, there is a lot of value for the practice to have one interface that will take care of not only their current needs and the requirements regarding electronic data exchange, but also what appears to be a growing number of future needs and requirements, many of which have to do with achieving meaningful use. Jim, I'm going to turn this back over to you.
Great, thank you, Mark. Now we can go to the next slide. Just to kind of summarize here with the pricing. Greenway's regular pricing net is charged to practices today averages between 4 and 10, sometimes more than 10,000 for all the interfaces that we work with them on. And that is primarily the bidirectional, all the data we talked about, and the registries, etc. And they have, for everyone that goes through SHARE, have waived those fees for all of those practices. And then SHARE is also covering all of the one-time fees that, and this is part of the grant process, which is approximately around $5,000 per practice that we pay to get everybody on our particular software, being the Optum software, the SHARE system. So we're very excited about announcing that, and Greenway has supposed to be a great partner, and we're really looking forward to working with them and all of your practices. The support fee for Greenway, once you go live, is their standard support fee of $20 per provider per month, and that is just one fee, so it's not per interface. It's one for everything that all of your connections through SHARE. And the SHARE's price that was published last year and is still into effect this year, and any changes will be notified in the future, but it is $50 per practice. Now, per doctor, again, I want to draw that up, per provider. It is per practice. So, and that if you have one system, for example, Department of Health, or a practice that has multiple locations, that's not per location, it's just per our connection fee to Greenway. So if you have one system that covers multiple locations, it still is the $50. Christy?
Okay, so now that you know a bit about what we've negotiated with Greenway, if you decide that you are ready to get started, it's real easy. Just go to our website, sharearkansas.com, and click on the big red banner that says Connect to Share, or you can call our office at 501-410-1999, and we will get you on the path to connectivity. So now we're going to turn the floor over to everyone on the line and take questions if you have any. We've got one question from someone who's wondering, what is SHARE's patient consent model, and how do patients sign up? Well, I can answer that question for you. We operate on an opt-out model, which basically means that once your organization participates with SHARE, all of your patients will have their data transmitted into the system unless they opt out. And the process for that is when your patient comes in for a visit, you will hand them a patient information brochure, which we can provide to you, which will give them information about SHARE and answer frequently asked questions. And then if they, after reading that material, decide they want to opt out, You'll give them an opt-out form to sign, and then you'll enter that into your system and give it back to Share, and we will flag their record as basically non-viewable within the system. Any other questions, thoughts, comments?
I'll ask for volunteers for our next our queue of Greenway practices. So anybody that would love to join, we would love to come out and chat with you. And you may already be using our secure messaging, but I think this is definitely something you want to look at, see how it may work in your workflow. No more questions?
All right. Okay, well, thank you all very much for joining us. That's all the time we have today for our webinar. We'll be sending out a follow-up email that'll give you information on where you can download the slides and view a video of this presentation online. I'll just go ahead and give you that web address right now in case you want to go. It's sharearkansas.com/Greenway. That's sharearkansas.com/Greenway. Also, we'd appreciate it if you could take a quick moment to fill out our 4-question exit survey that'll be coming to you momentarily. You can keep in touch with Share by visiting our website and signing up to receive our monthly e-newsletter. You can always follow us on Twitter at Share Arkansas and like us on Facebook at facebook.com/ShareArkansas. All right, thank you, everyone. On behalf of Kim Wagner, Mark Walker, and the team at OHIT, we really appreciate you for joining us and taking the time to view our presentation. Have a great day.
Thank you. Thank you.